Good afternoon, everyone, and welcome to ACNJ's Lunch and Learn on using data to understand the health of families in New Jersey. I'm Mary Coogan, President and CEO of Advocates for Children of New Jersey. I'm here to provide you with some information, answer some questions, and then hopefully we can have a conversation about how to use data to determine how children and families are doing and how we can improve outcomes for them. ACNJ believes that effective policymaking requires accurate current data. While data itself does not tell the whole story, it's an excellent place to start. For over 30 years, ACNJ has produced kids count reports for New Jersey, statewide reports, county pocket guides, all documenting key measures on child well-being at the county and state level. We've also produced data reports for the city of Newark, Trenton, Camden, and Patterson, and special issue data reports focused on juvenile justice, immigrant children, and babies. Data reports as well as ACNJ's data dashboard are available on our website at acnj.org, and other data is available through the Annie E. Casey website and their data center. The Casey Foundation funds a Kids Count project in every state and produces a national report as well. So the goal is to give this snapshot of how children and families are doing in an easily accessible way, and then to assess over time what the trend is, whether things are moving in a positive or negative direction. And then that's why we look at data over terms of 5 years. Now, COVID was an exception because some data wasn't available or there were just significant changes in the indicators that for a couple of years we just gathered data on a 1-year basis. So where do we get our data? We get our data from the Federal Census, Bureau of Statistics, the IRS, and also state departments listed here on the website. We also, for our city publications, will request data from local city departments. Sometimes we get data from community organizations who are helping us put the data book together as well. Reviewing the data indicators over a multiple year period can give us insight on how children are faring, especially after the COVID-19 pandemic and shutdown. So let's look at some demographics. This is actually, you're going to see this once our 2025 New Jersey Kids Count Pocket Guide is released, which is in the next couple of days. So right now, there are over 2 million children under the age of 18 living in New Jersey. 1 in every 4 are under the age of 5. And you can see just the demographic breakdown. This data comes from the Census Bureau. And as you know, there's a census taken every 10 years, but there's also a community survey, which is done on a yearly basis, where people in the community are asked to answer many questions, and then the Census Bureau compiles that data and then extrapolates certain indicators. So all of the demographic data reported here is what families have reported of how they view themselves in terms of their race or ethnicity. Here's some federal poverty data. So federal poverty is determined by a formula at the federal government, obviously. When you look at what would be 100% of poverty, that would be a family of 4 living with a household income of just over $30,000. As we know, New Jersey is an expensive state to live in, so we tend to look at low-income families, and that would be 200% of federal poverty, or for a family of 4, making just over $61,000. And you can see here there's been a slight decrease in the number of children living below the federal poverty level. So we wanted to look at some programs, right? Because families who are living in poverty do want to access programs that might help supplement their income, such as the Supplemental Nutrition Assistance Program. So this chart shows you the number of children whose households are participating in the SNAP program. And as you can see, it varies over a period of years. So there's been the most recent data from 2024 shows that there's close to 360,000 children who are living in households participating in the SNAP program. So I have been joined here by my colleague, Alena Siddiqui, who is at another event, and she is our data analyst here at ACNJ, formerly our Kids Count coordinator, and she is the one who's compiled all this data. So I'm going to let her go through the next couple of slides.
Thanks, Mary. So the next few slides, we're going to be talking about free and reduced price school meals. So over the past few years, the eligibility for children receiving free or reduced price school meals has been changing. So I've listed the eligibility levels for each year. And when you look at when we look at the total for children receiving free and reduced price breakfast or lunch, we see that the number has been gradually increasing with each change in eligibility. We're also seeing that while the number of kids receiving reduced priced breakfast or lunch has been decreasing, the number of children receiving free breakfast or lunch has been increasing. So there's been a shift happening with that. Next, this chart is looking at the rate of children who are receiving breakfast per the 100 participating in lunch. So it's essentially just showing how many kids are receiving both free and reduced price breakfast and lunch in their school. So in 2024, New Jersey had a rate of 57%, and 13 counties had a rate lower than that of the state. So we know that more work still needs to be done, as more than half of the counties in our state are not up to the level of New Jersey's rate. Next, looking at some health data. So we're looking at some health data broken down by race and ethnicity for New Jersey. The first table is showing the percentage of expecting women receiving early prenatal care by race and ethnicity, and we see that that there are disparities, and it's varying on who is receiving early prenatal care. The reason why we do boast early prenatal care is that it helps to ensure that the mother has a healthy pregnancy, and it just ensures that both mom and baby are healthy, and it's best to get this care as soon as possible. Looking at percentage of preterm births by race and ethnicity, also we see that, again, the disparities. For example, Black non-Hispanic babies had a preterm birth rate of 13.3% compared to other races. This is a much higher percentage, and we see this trend again with low birth weights. So in general, while we're seeing that the overall rate is improving a bit, we still have improvements to be made to ensure that everyone is getting the correct care that they need. Looking at New Jersey family care data. So in 2024, about almost 860,000 recipients under age 19 in New Jersey were receiving New Jersey Family Care and Medicaid. We see that this is a 3% decrease from 2022. And just looking at this chart overall, we see that the majority of counties in New Jersey have seen a decrease in New Jersey family care. Looking at some new data, there's a study was done that shows the lack of dental care available to New Jersey's young children. So a study was done during the summer of 2024 where the dental practices that are listed in MCO directories that were supposed to serve children between the ages of 0 to 6 were called, and it was to see how many of these Dental offices had accurate information and in terms of if they were providing dental care for 2-year-olds and if they had accurate insurance information in general. So we see that for looking at the state's total of the 824 dental practices that are supposed to be serving children 0 to 6, we see that only half of them had accurate information that provided dental care for 2-year-olds, and then 63% had accurate insurance information. And we see that for some counties, this percentage is higher. For example, Mercer County, 71% of the dental offices had a accurate insurance information. And then we compare that to a county like Salem, where only 38% had accurate insurance information. Looking at some childcare data, so the availability of licensed childcare centers varies across the state. In 2024, there are 4,092 licensed childcare centers. We see that there's been a very gradual increase over the years in the number of licensed childcare centers, but not too drastic. There's only a 1% increase since 2021. Other counties have seen a larger increase, such as Cumberland. They had a 13% increase between 2021 and 2024. And then we see that Hunterdon had the opposite. They had a 14% decrease in the number of licensed childcare centers. And since the number of licensed childcare centers hasn't been increasing too much, we see that the capacity isn't varying as much either. But capacity does not mean that all seats are filled. And again, looking at some of the data, we see that in New Jersey, there is a 400,460 seats available for licensed childcare centers. This does not mean that all of these seats are filled, but that is what's available. Looking at some education data. So while third graders are performing in similar ways in both English language arts and math, looking at this first table, we see that 44 in 23 to 24, 44% of third graders were meeting or exceeding expectations for English language arts, and 48% were meeting or exceeding expectations for math. When we look at the data for 8th graders, we see that in general, 8th graders are doing pretty well in English language arts, with more than half of them are meeting or exceeding expectations. But then when we look at math, we know that more work needs to be done. Only 19% met or exceeded expectations for math in the 23 to 24 school year. So it is a increase from 21 to 22, but we definitely should be making more improvements.
Okay, so I'm gonna do escape and stop sharing. Okay, so what does the data tell us, and why do we gather all this data? Part of the reason for gathering the data, and part of the reason we do the city books in collaboration with a group of community providers, is that we want people to take the data and use it to determine whether or not programs are working, whether maybe a program needs to be tinkered with, maybe a program is just no longer effective and we need to start over. Maybe a program needs more funding. Maybe we need a new program. And what the data can tell you is whether things are going in the right direction for kids, or whether we need to change something, restructure something, put in a new service, or just add some additional funding. And that's the purpose of putting the data together from our perspective. So we ask policymakers to use the data. We ask the community, residents to use the data. Some people use it for writing grants because they want to make an argument to a funder to say, with some additional data, with some additional funding, we could change the direction that this data is going in. And that's why it's a resource to you and to members in the community. But sometimes we also use the data to advocate for change. And it really is just the starting point. So what Alena just did was highlight for you a few of the indicators, and I'm just going to spend a few minutes talking about how we might use those indicators to advocate for change. So if you recall, we talked about the amount of kids who might be living in families of poverty, and then talked about SNAP, or the Supplemental Nutrition Assistance Program. So right now in New Jersey, because we all recognize that New Jersey is a more expensive place to live, the New Jersey legislature determined that anybody who's on SNAP should also have a minimum benefit. So a couple years ago, there was legislation passed to say, if you are in SNAP, you have a minimum of a $95 monthly benefit. So if you were only eligible based on your income to get $23 a month, you're now going to get that additional funding you'll get another $72 or $73 a month. So you get a minimum of 95. And the state was providing that additional funding. And so this, from our perspective, and obviously the legislature's perspective, was a positive for families. So as many of you might know, the federal government is currently in the process of a reconciliation, what they call, for a budget, where the Congress, the House of Representatives passed a budget resolution, and the Senate passed a budget resolution, and they've now come to an agreement. And part of the resolution says we are going to adjust the budget by cutting or increasing certain funding, including the debt ceiling. We're going to keep certain tax breaks in place that have been temporary and were due to expire at the end of the year. But in order to do that and have sufficient funding to run the government, instructions have been given to different committees to cut certain things. So currently, the Agriculture Committee has been instructed to cut $230 billion from programs that they supervise or monitor. And one of those programs is SNAP. So there could be a variety of ways that adjustments could be made. It's not that New Jersey is going to get $230 billion cut. That's across the nation, but it will impact the funding that we get here in New Jersey that funds the SNAP program. It could be that eligibility might change. It could be that people might have a work requirement. It could be that, there's an adjustment in how much money you will get per month. All right, but it could be significant, or it could be that the state just makes up the difference in the funding of whatever they lose federally. But other programs are impacted or will be impacted by these cuts. So for example, the school meals that Alena already spoke about are free or low-cost meals for breakfast and lunch. And while she identified a problem that a lot of school districts are serving lunch, but the same kids are not also getting breakfast, there has been a lot of work done in communities to try to change the eligibility, and so reduce the paperwork so that more kids can benefit from the free or reduced price meals. So for example, if you have about 24-25% of your families in your school district who would be eligible for some other type of benefit, such as SNAP, you now can determine your eligibility for school meals, that all of the families receiving that public benefit can now be eligible for the school meals. And that has alleviated that every family has to fill out an individual application. Well, under some proposals that are currently pending at a federal level, rather than 24% of families determining eligibility for the whole district, it might be 60% of families determined eligible for the whole district. So if you have 40% of your families eligible or might be receiving a SNAP benefit, you still have all those families will now have to fill out an individual application. I'm hoping this makes sense. But so it's just the changes and the progress that has been done here in New Jersey to really increase families who are eligible actually receiving the benefit could be undone. Another thing that I wanted to talk about, so we would then use this data and to advocate so that these cuts might not be made and share that information with our colleagues who also can advocate as well. So when you look at things like New Jersey Family Care, so New Jersey has one of the most expansive programs of public health insurance around the country. And that, again, is because our legislature determined that because it is expensive to live in New Jersey, and because many people may work multiple jobs or temp jobs that don't bring health insurance benefits as part of their employment, we should make sure that children are covered with health insurance so that they can get the preventive care that they need, such, if they need care for asthma, or they have some type of a sight problem, they need eyeglasses, or as Alena said, dental care, which is also covered by New Jersey Family Care, so that they are healthy and ready to learn when they go to school. So a lot has been done. And while the numbers are slightly down in the enrollment of New Jersey Family Care, I think much of that is the result of, as we came out of the pandemic, people going back to their old jobs where maybe they were making a higher income level, and so they don't qualify for family care anymore. But we still have over 830,000 kids who are enrolled in New Jersey Family Care. And family care is paid for by federal Medicaid dollars, federal CHIP, or the Children's Health Insurance Program dollars for the higher income level families, and state dollars. All right. So children who are enrolled in New Jersey Family Care and eligible, except for their immigration status, they can be enrolled in New Jersey Family Care, but their benefit is paid for solely by state dollars. Okay. So going back to the federal budget reconciliation process, the House Committee on Energy and Commerce has been instructed to find $880 billion in cuts from programs that they monitor, which includes Medicare and Medicaid. It is likely that there's going to be significant cuts across the country in Medicaid funding. And while many people in Congress have said, we want to make sure those who are eligible retain the benefit, when they talk about the benefit, they may be changing eligibility. So, for example, until now, for New Jersey Family Care, we also allowed low-income adults to get the benefit. And this was a result of when the Affordable Care Act was passed. It was called the Medicaid expansion. And that was because even though people were working, they might not have had a health benefit. So that reimbursement might change in terms of what the state gets back from the federal government. Or the federal government could say, we're no longer going to fund the Medicaid expansion, or they may say that there's a work requirement now. Okay. So because of that funding change, that may result in changes to the family care program, such as right now, we don't have a premium. Families are not required to pay a premium. And that was in part because a lot of times if families couldn't pay their premium, they were disenrolled from family care. And then the next time their child went to the doctor, they would get re-enrolled. And so we decided as a state to stop the premiums. There's very few co-payments in family care. And so that might have to change if, as a result of the Medicaid cuts. So again, we take this data and we say, especially during a crisis like the COVID-19 pandemic and the shutdown, when people were furloughed and lost their jobs, they were able to enroll in family care to continue their health insurance coverage, right? And so if there are Medicaid cuts and we have to change the eligibility, that benefit won't be available next time that there is a crisis. And that could be problematic. Or just the fact that people who are struggling to meet their expenses, who can't afford a premium, may just decide to let that health insurance lapse, which would not be a good thing for kids or for their parents who are enrolled. The other thing I wanted to mention was, I think Alena showed some things. Childcare is obviously a big issue here at ACNJ. And what she was pointing out was that there is a difference between licensed childcare centers and the capacity. So if I own a childcare center, I get licensed by the state to have, 15, 30, or 50 children in my childcare center. And that's because of the size and my staffing, et cetera. And there's certain requirements that I have to comply with. As many people know, our childcare system is in a state of crisis, and centers are struggling in many parts of the state to maintain staff, right? And that could be because they can't pay the same wages as certain retail stores, and so people have just moved to other jobs. Coming out of COVID, people just decided to retire and they no longer wanted to work in childcare. So while I might have the capacity of 50 or 75 children, if I don't have the staff that I am required by licensing to provide the supervision for those children on a consistent basis, then I can't open my entire center to anybody who needs help. I can only open my center to help those people that I have staffing for. And so those kinds of things that people don't see just from the data are the things that ACNJ works with our other partners to make sure that policymakers understand that if we really want to make sure that everybody in New Jersey has access to the childcare that they need, we want to make sure that centers can pay their staff a comparable wage so that they can retain their staff, retain trained and appropriately trained and educated early learning staff who can, take care of the children while parents are at work. And so we might need some additional investment into the childcare system here in New Jersey. So those are just a few examples of how we use the data at ACNJ to advocate for change and to make sure people understand the story behind the data. Because sometimes, while it is accurate, it doesn't tell you the full story. And I guess at this point, I'd be happy to answer any questions, or if anybody who's on this call wants to share any data that they're aware of that could help improve outcomes for kids, we would love to hear from you.